Good afternoon and welcome to our national webinar on promoting health equity uh, through economic mobility hosted by the Bipartisan Policy Center and Trust for America's Health. My name is Tim Hughes, the External Relations and Outreach Manager at TIFA. We would like to thank our speakers and audience for being with us today. Next slide. Real-time captioning is provided today by Jen of AI Media. For captions, click on More on the bottom right of your Zoom screen and enable captions. Next, click on Close Caption. ASL interpretation is also being provided today by Becky with Keystone Interpreting Solutions. If you'd like to use ASL interpretation, hover over your cursor over the interpretation button on the bottom of your Zoom screen. Next slide. Next slide. We encourage you all to share your thoughts and questions about today's presentation by typing them into the Q&A box. We'll try to answer as many as we can as time permits. To open the Q&A box, click the Q&A icon at the bottom on your screen. From there, select Enter when you are ready to submit your question. And as always, today's webinar is being recorded. That recording and slides will be made available on TIFA's website by the end of this week, as well as Bipartisan Policy Coalition's website. And now, next slide. And now it is my pleasure to introduce the moderator of this event, Dr. Takesha Dwan Everett. Dr. Everett is the Executive Vice President of Trust for America's Health. In this role, she works in partnerships with TIFA's President and CEO to chart and implement the organization's strategic direction and priorities, provides counsel on current and emerging policy issues, and engages with key organizations, policymakers, and other partners to advance policy priorities to improve public health and promote equity. Most recently, she served as the inaugural Executive Director of Health Equity Solutions, a statewide nonprofit dedicated to advancing health equity through policy and advocacy in Connecticut. Welcome, Dr. Everett.
Thank you so much, Tim, and thank you to everyone for joining us today for this important discussion. As already mentioned, I am Dr. Takesha Everett, the Executive Vice President here at Trust for America's Health, known by TIFA for short. First, I'd like to welcome all of you and thank our esteemed panelists for taking the time to attend this event. We are honored to have you all here. Our agenda today is on the next slide, so next slide. Our presentations will start after a brief introduction from me and of the panelists, and then we'll move to our discussion of, we'll move to discussion and questions from the audience at the end of those presentations. My hope for you is that you will leave this briefing having a better understanding of the impact economic supports have in further addressing the economic needs of communities, improving their financial stability, and promoting their health and well-being. We'll highlight COVID-19 pandemic financial assistance programs and opportunities to enact evidence-based policies and the role those policies have in addressing racial and social inequities at the federal, state, and local and community levels. Next slide. We will have some questions we will save questions for the end of the discussion, as I've mentioned, but just a reminder, if you have questions throughout, we encourage you to place those in the Q&A so that we place those in the Q&A section and not the chat section so that we're able to track those and answer those questions after the presentation. I'm now pleased to welcome our panel, the reason we're all here today. I first want to start by introducing Rachel Snyderman. Rachel serves as the Director of Economic Policy at the Bipartisan Policy Center, also known as the BPC. At BPC, she leads a team dedicated to advancing economic policies that expand opportunity and financial security for workers and families. Rachel joined BPC following federal service with the Millennium Challenge Corporation, the Department of Commerce, and the Office of Management and Budget. Her work is largely featured regularly in major news media outlets, such as the New York Times and the Washington Post. Our second panelist, Isabel Dixon, is the Economic Mobility Program Manager in the Children, Youth, and Families Branch at the Colorado Department of Public Health and Environment. In this role, she serves as the lead strategic director for economic mobility at the Colorado Department of Public Health, and she helps in identifying and implementing evidence-based strategies to improve the financial well-being of Colorado families. I'm going to pause for a second because I'm receiving some notices that perhaps my sound is a little off. So I'm going to troubleshoot for a second to correct that. And shortly afterward, I will hopefully be able to change devices to make this better if this actually doesn't change the volume now. Lastly, I want to introduce Leandra Lacey, and Leandra Lacey is the Training and Technical Assistance Manager in the Research to Action Lab at the Urban Institute. She designs and delivers tailored technical assistance for community-based organizations supported by the CDC-funded Partnering for Vaccine Equity program. She also leads the design of an intensive technical assistance model for the Upward Mobility Framework project funded by the Bill and Melinda Gates Foundation. Her research portfolio with the Urban Institute involves maternal health equity. Before joining Urban, Lacey worked in university, clinic, and nonprofit settings on sexual and reproductive health research, education, programming, and capacity building. I read a brief snippet of each of their bios to generally tell you how great and phenomenal each one of the panelists are, but you can access their full bios at tsah.org, where we will also be sharing the recording of today's webinar. Next slide. So now it's my pleasure and my honor to bring Rachel to the stage, the virtual stage, to do her presentation. Rachel, it's all yours.
Thank you so much for that warm introduction. It's a pleasure to be here today. If we could go, Eliana, to the next slide, that would be wonderful. Thank you so much. Oh, and the next one then too. Thank you. So we're here today to talk about economic mobility. And when we do that, we're really looking at a central question. Will our children be better off economically than us? And this is really important to consider given existing economic and the existing economic and social environment that we find ourselves in and the policy supports necessary to confront it. TIFA's report and so much of their work focuses on examining the issue. And in that report in particular, they lay out significant policy tools at our disposal, such as the Earned Income Tax Credit, access to paid family leave, and affordable childcare. And these and other supports are critical to American workers and their families. I'm going to briefly touch on a few of them and the evidence base that we have to support their efficacy. And then I'm going to describe at a high level just the current federal policy landscape that we find ourselves in and really where we go from here. At the Bipartisan Policy Center, we spend a lot of our time focusing on economic opportunity and what are the policy levers that both sides of the aisle, frankly, can agree on that focus the conversation around economic opportunity and truly helping all Americans thrive from childhood to retirement. And what makes studying the economic tools so fascinating in the United States in particular is that so many of these economic mobility tools are provided to Americans through the federal tax code. Policymakers have increasingly turned to the tax code to implement, and I'll really say, both in the individual and the business sides of the tax code over the past decades to enact social programs that provide critical financial support that American workers and their families need. So for this conversation, I'm really going to focus on kind of 5 of those that we're seeing kind of dominate a lot of the federal policy landscape right now, recognizing that there are several others, and we're going to talk, I know, and dive deep even into their impact at the state level as well later on in the presentation today. So if you could go to the next slide, that would be great. Thank you. So on the individual side of the tax code, we're hearing a lot in the news among policymakers, both again at the federal and the state levels, surrounding the child tax credit, the earned income tax credit, and the child independent care tax credit. Now, the child tax credit is a credit that is given to parents and eligible caregivers at tax time. It's currently worth up to $2,000 per child, and that eligibility is determined on a number of factors, primarily on earnings, and of course, the number of children that a family has. There's also the earned income tax credit, which is designed to effectively raise the after-tax income of a worker with a low to moderate income and incentivize them to not only enter the workforce, but to increase their earnings over time. Given how the tax credit changes, and that also is dependent on a number of children that an eligible worker has as well. In 2022, for example, the average EITC that was claimed was about $2,540, which is pretty significant. There's also the child and dependent care tax credit, which is a credit that is helps families offset, the high cost that we pay for childcare, and also to families who are taking care of adult dependents or spouses who need additional assistance. So families can claim up to $3,000 for independent care expenses for one child or dependent, or up to $6,000 for an additional child or dependent. There's a large body of research that looks at particularly these three credits as critical anti-poverty tools, and their positive effects on household economic security, health, and education outcomes, among several others. A few that I'll note is that there are studies that show that claiming the child tax credit and the earned income tax credit can help increase the birth weight of children, decrease the rates of infant mortality, improved health outcomes for mothers, also improved health insurance coverage, and also better weight control, for example. So, these are just a few of those economic linkages to public health outcomes that are critical when we think about the importance of these tools. And we also know too that the linkage between broader economic improvements and health outcomes, help with labor market participation and labor market productivity, of course. So these are really critical anti-poverty tools to have in our arsenals. And they're so critical that, we've even seen states implement their own versions of these federal programs at the state level over the past years. We know that 14 states have their own child tax credit in addition to the federal tax credit. 31 states and Washington, D.C. have an earned income tax credit. And 28 states have their own version of the child and dependent care tax credit. BPC actually has a map that I encourage you to engage in that looks at all of these. There are also some really, on the business side of the code, credits that provide incentives for businesses to support their employees when it comes to childcare and paid family leave. And these are the employer provided tax credit and the paid family and medical leave tax credit. We've seen countless studies that also show that access to paid family leave and affordable childcare keeps new parents attached to the workforce while also supporting the healthy development and outcomes for their children. I know we're also going to get into, we're going to touch on those issues later in the panel as well. If we could go to the next slide, please. Where I want to leave you with our discussion is, where do we go from here? I'm joining you from Washington, D.C. You can take a look at your local newspaper, federal headlines, and things are turbulent here. It seems like no one can get along. But what we've learned really from the height of the pandemic is that so many of these tools in particular were expanded because we know that they work when it comes to poverty alleviation and the types of supports that families need. And so there's been so much momentum following the pandemic about how we can better support families through interventions, through programs that the tax code already supports. We saw, for example, that in the height of the pandemic, the changes that were made, the expansions that were made to the child tax credit cut child poverty in half. And so that's really been a big part of the discussion since the pandemic is how we can think about better targeting these types of supports so that families who need the most assistance can get that assistance, and that folks also have access and the education necessary to know that they are eligible to claim these programs. And again, I noted that it seems like every day Washington is broken, but I want to leave you with some optimism because there is a lot of development, a lot of momentum surrounding paid family leave, affordable childcare, these critical tax tools that connect workers and families and support them. There is bipartisan momentum on the Hill to push for a paid family leave solution. We've also, and I'm happy to answer in the Q&A, current discussions and negotiations surrounding expanding the child tax credit. And what this is all really staring us down is that in 2025, we're going to see the expiration of the 2017 Tax Cuts and Jobs Act. These are kind of known as the Trump tax cuts. And really, almost every individual tax code provision is going to be on the table ripe for negotiation. There are actually going to be a lot of priorities in there that both Democrats and Republicans support. And I think that economic mobility is going to be really the thread that that holds us all together when we have those conversations about tax reform next year. So with that, I will kick it back to you, to Keisha, and look forward to engaging in the Q&A.
Thank you so much, Rachel, for that wonderful outline of kind of giving us that federal policy landscape and bringing the two issues of economic mobility and tax policy together in such an easy, breezy way for us to understand it today. I now want to turn our attention to Isabel and bring Isabel forward. Isabel from the Colorado Department of Public Health and Environment, please take the virtual stage and give us your take on this from the state level.
Thank you so much, Keisha, and thanks for having me today. I'm the Economic Mobility Program Manager at Colorado Department of Public Health and Environment, which is Colorado's state health department. So we know that public health is increasingly talking more and more about the role that social determinants of health play in addressing health inequities. But what does that actually look like in state and local public health settings? It can be a bit murky. So I'm going to talk today about what this work has looked like in practice in Colorado. Next slide, please. So a little bit of framing first. We're all aware that the cost of living has become untenable for many of the families we serve. Housing costs are high. The median house cost in Colorado is now almost $600,000, and our child poverty rate is 11%. Communities around the country have experienced similar economic stress combined with the economic impacts of the pandemic, which further exacerbated health inequities. And we know that economic need is tied to poorer health and educational outcomes and increased involvement with the child welfare system. Next slide, please. Thank you. So those of us in public health usually understand the relationship between economic status and health, but we may hear the question, why are you talking about economic mobility? Why are you talking about tax credits? And I really, for our team, we think about it in two ways, the two main reasons. So first, as Rachel noted, research has confirmed the relationship between lower incomes and worse health, and children who grow up in poverty or experience poverty for an extended period experience more adverse health consequences throughout their lives. And the second reason is that public health already has the networks and partners that can reach those who can most benefit. The role of public health here is similar to other programs in disease prevention. We've found, so sharing data, research and recommendations, tools, technical assistance that help support our partners in their community work. And we don't have to determine what to focus on from scratch because national partners such as TIFA and the National Academies of Sciences, Engineering, and Medicine with their roadmap to end child poverty have identified informed recommendations on evidence-based policies and practices that can address economic needs. So I'll talk about some of those specific strategies in just a moment. Next slide, please. Just a few words. We sometimes get questions about how we were able to kind of stand up and resource this work at the health department. Our economic mobility program sits within our Title V maternal and child health block grant program. So this provides stable funding and staff time and has been critical to standing the program up. And we did that a few years ago as part of our needs assessment that MCH, or Maternal and Child Health, conducts every 5 years. And through that process, Colorado was able to select 4 new priorities that focus on the social determinants of health, one of which was economic mobility. So this provided backbone funding that then we were able to leverage into additional funding sources. Of course, it helps to have dedicated staff time, but you don't have to have this. Some work, tax referral, for example, can be done at a low cost, making tax or credit referral part of the benefits referral conversation can be pretty simple. There are amazing toolkits such as the Center for Budget and Policy Priorities Get It Back campaign, and the IRS has a new one that's good now too that you can use. Next slide, please. So there's many strategies and areas of focus a program can use, and the work is really going to look different in different states and at the community level, depending on what policies and programs are available in your state. So Colorado has a really progressive tax code now, but many people don't know about these opportunities. So we're pretty focused on that. You can see some other things we focus on there, like paid family and medical leave, Bank on Colorado for banking services, and unified benefits enrollment, and some other options there. If your state doesn't have a policy like a state child tax credit or paid family and medical leave, the federal earned income tax credit is a tax policy that is nationwide that you can help people learn more about. So I'm going to use tax credit outreach as an example today because it's a powerful evidence-based policy to support the economic mobility of individuals and families, and because this is where our work has been focused. Next slide, please. So just a brief background on why we're focused on tax credits, why they matter. We know that tax credits reduce poverty and improve long-term outcomes, and Rachel covered those specific outcomes well, so I'm not going to go over that again. And then on this slide, you can see what the power of refundable credits is when you lay it out against things that we're very used to in public health referring to, like WIC, TANF, and SNAP. And you can see that these anti-poverty programs are highly effective at keeping children out of poverty, and refunds, tax refunds, are flexible cash that families can spend how they see fit. And you can see some of the amounts highlighted here, and that they can really add up. Next slide, please. Unfortunately, millions of dollars are left on the table in unclaimed credits, and in Colorado, about 28% of Coloradans eligible for the EITC don't claim it. People don't file for various reasons, but typically it's because they don't make enough money to owe tax, they're not required to file, and they aren't aware they're eligible for these benefits. New parents, grandparent caregivers, or others that might miss out, as well as newcomer populations and those who speak a language other than English, and rural families. Next slide, please. So getting the word out in Colorado, we've worked with our partners and a media firm to get the word out. We have a public information campaign called Get Ahead Colorado and Hacia Adelante Colorado that includes a partner toolkit with ready to go assets that anyone can share. We have a media plan working through radio, TV, and digital media. We provide training and technical support to our direct service programs. And then we have grant programs to our volunteer income tax assistance partners, community-based organizations, and local public health agencies. Next slide, please. So I mentioned sharing data. This is just a screenshot of our dashboard of earned income tax credit claims data along with child poverty rates. And this tool allows partners to check for themselves what EITC claims rates are in their area, what the supplemental child poverty rate is in their county, and whether there is a VITA site, volunteer income tax assistance site nearby that they can partner with and refer to. Next slide, please. Finally, I want to highlight the importance of language translation and interpretation for equitable access to this information and other SDOH information, because listening to our community-based partners, we really heard that need for step-by-step tax information in multiple languages. So we developed some of these documents available in up to 19 languages. Next slide, please. And I want to really highlight that all of this work takes place 100% through our partnerships. They are the experts in their own programs and how to get the information out to the people they serve. So our partners in human services and early childhood have leveraged those incredible networks in hyper-local ways, such as county human services offices and early childhood councils, the state unemployment application process, and the state attorney general's office of financial empowerment. Our VITA grant programs are really getting it done in communities and expanding free tax filing capacity around the state. 211 call centers are critical. Often the call for action with this work is call 211, so they're there. And then I want to note that our request for application process used an inclusive grant making process. So this infused community priorities into the grant announcement itself. And then final funding decisions were made by a grant committee made up of 50% community members. And finally, the project has allowed us partnerships outside of kind of our usual suspects. So banking, tax, a partnership with AmeriCorps, and using some voter registration techniques to engage community members on filing. So I'm going to wrap it up there. Thank you, and I'll pass it back to you, Keisha.
Thank you, Isabel, for that wonderful state example of how you can really partner with others and be collaborative from a public health department to expand economic support and the awareness of what's available to folks at the state level that could be used in any state. We're now going to finally turn and hear from Ms. Leandra Lacey from the Urban Institute. As a reminder, you can submit your questions to the panel in the Q&A feature, and after Leandra speaks, we'll begin to answer some of your burning questions. So now I'd like to turn it to Leandra.
Thank you so much for that warm welcome, and hello everyone. Again, I'm Leandra Lacey. I'm a training and technical assistance manager with the Urban Institute. Urban is a nonprofit research org in Washington, D.C., and we provide data and evidence to help advance upward mobility and equity. I also serve as the co-lead of our intensive technical assistance team, which is part of the Upward Mobility Framework project at Urban, funded by the Bill and Melinda Gates Foundation. So I'm just excited to join this wonderful panel today and share a little bit about the Upward Mobility Framework, including its three-part definition of mobility from poverty and its connection to health. Next slide. So the framework emerged out of a previous initiative, the U.S. Partnership on Mobility from Poverty, which ran from 2016 to 2018 and included a lot of cross-sector leaders convened by Urban. And what the partnership found is that economic success alone is not enough to move out of poverty. And in order for folks to move out of poverty and stay out of poverty, people also needed to feel that they have power and autonomy in their lives and that they are valued in their community. So they defined economic success as when a person has adequate income and assets to support their and their family's material well-being. And power and autonomy is when a person has the ability to have control over their life, to make choices, and to influence larger policies and actions that affect their future. And being valued in community, this third part, is when a person feels the respect, dignity, and sense of belonging that comes from contributing to and being appreciated by people in their community. And research and people with lived experiences of poverty made it very clear that if jobs came with more money, but didn't also come with more power or more choice, then upward mobility wasn't very sustainable. And if we really want to increase mobility from poverty, we need to make progress on all three of these fronts. So just an example, programs that do neighborhood empowerment but don't focus on how to bring more wealth to a community won't be able to sustain that neighborhood empowerment. And to make that progress, we have to be able to measure it. And people are much more used to measuring economic success, as we know. But that doesn't mean that there aren't other measures for the other two dimensions. Oh, great. We're already on the next slide to talk a little bit more about the framework and the mobility metrics. So I mentioned that the framework starts with a three-part definition, and then the next part are these 5 essential pillars. I know it may be small on the screen, but those 5 pillars are opportunity-rich neighborhoods, high-quality education, rewarding work, healthy environment and access to good healthcare, and then responsive and just governance too. And these essential pillars overlap to some extent and reflect the diversity of policy domains that are relevant to mobility from poverty. So communities need strong, equitable pillars of support, but also need a focus on racial equity. Then there are the predictors, which reflect the strength of those pillars. And for each predictor, there is metric. So that amounts to 26 metrics, since 2 predictors have 2 metrics that align with them. And I'll talk a little bit about those later too. And the reason that we decided to move beyond just that 3-part definition is that we wanted to find ways to measure all 3 dimensions and do that in a very comprehensive but concise way, so that local leaders like yourself, a lot of the participants here, could use them to understand whether their community could support mobility from poverty. And in order for communities to become these launch pads for mobility, local change makers needed these measures of conditions that they can influence. Next slide, please. So to get to our current set of mobility metrics, Urban convened a cohort of 8 county governments and their non-government partners from 2021 to mid-2022 to beta test the original set of mobility metrics and the upper mobility framework. So throughout this 18-month engagement of providing technical assistance, we led the counties in analyzing their mobility metrics data, gathering additional local data to provide context on the challenges seen in the metrics, and providing them support in those arenas. And the counties engage with a wide range of stakeholders, which we supported, working on mobility from poverty within their county. And we helped each team develop and execute a community engagement plan to gather insights and ideas from community members. We also helped them research evidence-based best practices and solutions. And at the end of the 18-month agreement or engagement, each team published a mobility action plan, setting forth a set of strategic actions that they'll take to boost mobility from poverty in their communities. And we made revisions to the mobility metrics based on what we learned from that beta cohort. Next slide. Just a little bit about the mobility metrics. Localities can use it to compare their community's metrics to peer communities to assess the extent of the local mobility challenge and build public support for tackling it. The metrics can also reveal persistent racial inequities and the structural barriers that perpetuate them. There's prioritize here. It helps folks prioritize mobility predictors where the community's focused attention and action can have the greatest impact. The metrics also highlight interconnections among predictors from different policy domains to recruit partners and identify the roles different actors can play. It also sets targets for improving local mobility metrics and narrowing inequities as part of a strategy for meaningful changes in investments, policies, and practice. And last but not least, it also helps to monitor the metrics over time to assess a community's progress and hold local stakeholders accountable. Next slide. Here's a deeper look at the predictors that fall underneath the pillar healthy environment and access to good healthcare, along with the corresponding metrics for each predictor. So our mobility metrics data tables, which can be found for free online, I'll have a link to that later in my presentation, are designed to help local leaders in every county and with cities with populations over 75,000 in the US, measure the status of and progress toward increasing upward mobility and equity in their communities. And you may be asking, there's only 4 there. Aren't there many other factors that influence health? And you're right, that's true. But when creating the mobility metrics, there was a set of very specific criteria that we had, including data that is repeated at regular intervals, making sure the data was available for cities and counties nationwide, data that was consistently collected and calculated, making sure that data was available for important subgroups, especially by race and ethnicity. So there's a whole list of criteria that I could talk about, which is how we landed on those 4 metrics for this area of the framework. Next slide, please. So here's an example of how the framework relates to health. So I'm sure, as you all know, structural racism in the health domain can impact someone's ability to achieve that 3-part definition that I mentioned. So for example, the inequitable placement of healthcare services favoring whiter and wealthier communities, or the placement of environmental contaminants like factories in communities of color can impact someone's mental and physical health, and obviously leading toward potentially impacting their ability to work consistently and earn higher wages, and can cause them to have to spend a higher share of their income on health, and can impact their ability to cope with stress and have the positive mental health needed to feel that they can make choices and form close relationships. Next slide. In their economic mobility catalog, our colleagues over at Results for America also acknowledge health and well-being as a critical foundation to mobility outcomes. So they highlight the Rapid Employment and Development Initiative in Chicago in 2017 as a case study exhibiting the strategy of gun violence prevention, which they relate to the issue area of health and well-being, and related also to the outcome areas of stable and healthy families and supportive neighborhoods. So through community partnerships and a commitment to using data to inform program improvement, they saw major success with 72% of participants who started transitional employment continuing to be employed after 6 months. And this truly illustrates the interconnectedness of health and mobility, which we're here today to discuss. Next slide. So lastly, I wanted to wrap up with some links to various resources if you're interested in doing a deeper dive, including the Upward Mobility Framework website, the Planning Guide for Local Action, which Urban created to help people working locally in upward mobility, facilitate a upward mobility planning process by taking them through a 10-step process. There's also a link here to sign up for the framework listserv if you want to receive project updates, including new research or blogs and webinars. And lastly, there's a QR code here to access your location's mobility metrics data tables. And this is available for every county in the US and for cities with populations over 75,000. So I hope you take advantage of that if it's of interest. Thank you.
Thank you so much, Leandra, for that amazing presentation, connecting mobility and health at this super hyper local level that you gave us an example, but also providing the framework behind how you got there. For everybody listening, this concludes our panel presentations. And as promised, now we're going to open up for questions and answers. As a reminder, you've already been doing it, but we encourage you to do it more. Submit your questions through the Q&A panel on Zoom, and we will get to as many of your questions as we can today. And I'm so excited to help to be joined by my colleague, Dr. Brianka Merritt, to help facilitate this part of the conversation around questions. Dr. Merritt is the Director of Policy Development at Trust for America's Health and is one of the key staff persons behind the webinar that we have today. So I'm going to start with my first question, and I think I'm going to go to Rachel because, Rachel, when you concluded your portion of the presentation, you kind of ended on this note about Congress. And I want to bring Congress to the conversation again, even though, as you mentioned, we can open up our local newspapers or the television, and we're hearing quite a bit these days. But what steps can Congress take to make temporary benefits that were instituted during the pandemic, where we've seen great progress, more permanent?
So, it's an excellent question, as what we've been spending a lot of our time on. I'd say first and foremost, there's a tremendous opportunity as we look at 2025. I noted that, there's going to be an opportunity for really significant bipartisan tax reform, given the slim margins that we see in Congress. It's going to take both parties agreeing on something to get anything done. When it comes to kind of the pandemic supports, we learned a tremendous amount from, on the child tax credit, for example, the importance of refundability of the credit and targeting it to families, lowest, had the greatest impact on lowest income households. And so that's some of the, some of those tweaks we've seen, have bipartisan support currently in the current tax bill that passed the House. It passed the House, it's a big deal, and is now being negotiated in the Senate. When it comes to things like paid family leave, for example, though, the pandemic implemented temporary supports for workers to assist their employees with paid family leave, but the take-up of the credit was so incredibly low because it wasn't really matched with that education and outreach component that's so critical, that employers need to know kind of, they were slapped with, you can apply for a small business loan. Folks are claiming unemployment insurance. Like there's a plethora of programs that were expanded truly overnight, and just, and many of which multiple families qualified or workers or businesses qualified for at the same time, but not really that central operating system or communication system, if you will, to help folks, really make sense of it all. And that's why I think when we look at, and that's at the federal level, I think that's why we look at the work that Isabel's done in the state. It's so crucial because, this is really where folks can learn about not only the federal supports, but of course the state. And then too, I'd say just a lasting impact from, we've known, for example, that programs like the earned income tax credit, the child tax credit, longstanding bipartisan support around those programs. And so I think it's kind of keeping that pedal, that foot on the pedal there, that, ensuring that these programs are modernized, that they're meeting the needs of the current workers and current families is so crucial. And remembering that, these were implemented and supported and expanded by presidents, Congresses in control of both parties over time. So it's really just important to remember that and to keep that part of the dialogue going forward, even as our politics become so polarized.
Thank you, Rachel. That was a great answer. I took so much away from that. Dr. Merritt, do you have some questions from the audience that you'd like to field to our panelists?
Absolutely. And thanks for everyone for keeping those going. Thank you, Dr. Everett, and to our panelists for such a rich discussion. Our first question is if the panelists are aware of any states that are prioritizing workforce development as a key strategic lever for health equity?
All right, so I think any one of our panelists could answer that, but I'll ask Isabel first, because you are in the state, at the state kind of level. Do you know of anything going on in Colorado, or maybe you know of other states that are looking at workforce development as a strategy?
I think there's a lot of very innovative workforce development activities taking place around the country, apprenticeships, things like that. For us, it's been really just getting to know our friends over in the Colorado Department of Labor and Employment so we can understand what they even do. State agencies can be big and complex, have many programs that are not known to the other agencies. So partnering with them, regularly meeting with them and understanding their statewide workforce development offices and how we might refer to those has been important, as well as partnering with them to place tax information on their unemployment application webpage, for example. Little things like this can be low cost and highly effective, and we can see that in the web traffic that web widgets like that on other state agency programs drive to our program. But it's definitely of note that workforce can be incredibly important when people are ready to take the next step in designing what their dream is for their education and their future employment and their economic security.
Hey, thank you, Isabel. Rachel, Leandra, anything you want to add before we go to another question? Not seeing either of you off mute. I think you're good. Okay. Dr. Mira, do you have another question? And then I'll ask something.
I do. I would love to hear from the panelists about how can clinical healthcare providers contribute to the mission of improving economic mobility and health equity?
This is a great question, because I think, right now we're seeing a lot of emphasis on clinical providers thinking about and addressing the social determinants of health. So for this question, Rachel, Isabel, or Leandra, any thoughts on how clinical providers can either integrate or access some of the work that you're talking about, or maybe some of your specific work, and or other ideas that you have for clinical providers?
I can kick us off with that one. So when thinking about clinical providers, one thing that I would encourage, especially when thinking about the upward mobility framework, is trying to see how their work connects to that framework and considers other elements of upward mobility. So let's say they're running a health program. How could that program create power and autonomy, for instance, or that belonging and dignity? So it's not just focused on one element, but they really acknowledge the interconnectedness of it all and take that acknowledgement and put it into action to see how they can address other elements. So, maybe it's transportation access, maybe it's having the language capacity at their clinic for those that may not speak English. So making sure that they're thinking about all of those elements.
And it's an excellent point. And the only thing I would add is that, healthcare providers are in so many communities, the central point of trust, right? I mean, we trust our pediatricians, we trust our primary health physicians that they're giving us the best guidance and access to what we need to maintain a healthy lifestyle. So much more so, I think that folks probably trust their doctors more than maybe their politician. I'm not sure if what polling is out there on there, but I think that it's a really important beacon of education for households. To have, for example, we saw in the pandemic, some cities, work with pediatrician offices, work with doctors' offices to have pamphlets and information about some of the expanded benefits that were provided during the pandemic, from the child tax credit to, further down the road, such as childcare supports. And so I think that, being kind of another library of sorts for folks to have that indirect tool and an education component is really critical and a low cost, I'd say, with a high impact.
And I would just add that many hospitals are doing this. They are making that jump to referring to social needs as part of their care. In some cases, they're required to do so as part of the hospital transformation projects that many are engaged in, and that this can really look like, screening, referring, and connecting to social needs and resources in the community, and then measuring the outcome of that. What is the effect of connecting people to housing resources, for example, on ER visits? And then for public health, the role can often be to support with what are the resources in the communities that can go into the database, as well as increasing that comfort level for programs and clinicians to talk about tax, that you don't have to be a tax expert to refer to free tax filing. Just asking, did you file your taxes? You might be eligible for this child tax credit, so don't miss out, can be all that's needed to say, not to study up on the tax code or anything like that. So there's a lot of opportunity there for sure.
Wonderful. Thank you so much for responding to that. Isabel, I'm going to turn it back to you. So keep your mic, your button off mute really soon. We saw a couple of people in the chat asking a lot of questions, or being very interested in the model of what Colorado is doing in the Department of Health. Could you speak a little bit about, as other states might be thinking about this, the model of your program and how they could implement it, how important federal funding has been or is to supporting the work you're doing at the state level?
Yeah, sure. I mean, in short, very important, because, you know, grants are wonderful and allow programs to scale up and reach more people, but the stable funding of Title V has allowed us continuity and the space for innovation. And stable funding can sort of smooth those fits and starts of kind of boom and bust funding, allow programs to gather data over time about what's working, take stock, and run improvement cycles to get better. And then more sustainable public health funding overall would allow us to take off our grant writing hats and get to work to build and keep momentum in our programming. At a program level, though, it is also important to provide strategy options for partners such as rural partners who only have the capacity to implement 1 or 2 simple actions in their communities because they wear so many hats in their public health departments. So kind of answering those needs while we're trying to innovate and move upstream, as we say.
Thanks so much. And Leandra, I'm going to turn the mic over to you and ask you, following up on that, thinking about data, and there's clearly important use of collecting, Urban Institute and specifically about collecting and having access to data is very important to your organization. Can you speak to the importance of having good, available data on economic mobility? And are there any barriers that the Urban Institute has come across in doing this research?
Yeah, I mean, it's extremely important to collect data around economic mobility. I think data can tell a really powerful story. And I think about even our local guide for our planning guide that we have that I linked to before. And a huge part of that is it talks about data, understanding the mobility metrics, how to access it for your jurisdiction, noting insights for your locality, but also comparing your jurisdiction to others as well. I think that's really important too. And one challenge I think of when it comes to those at the local level that are trying to collect data is that they want to collect everything. Folks they're really interested, and they go down this almost data rabbit hole. And sometimes people ending up wanting more and more and more data and spending a lot of time looking at the data, but not actually getting to solutions. So I think something that has helped, and when thinking about our beta cohort, is having a really specific research question that localities are trying to answer when it comes to economic mobility. I think that'll really help and kind of narrow their search, so it's not just open, super open, but really help them to search for only the data that is absolutely needed. So that's definitely a challenge that comes to mind.
Thank you. Okay, Dr. Merritt, we're going to come back to you for some more audience questions.
Sure. And folks, some of the panelists kind of spoke around this, but maybe some specific opportunities about how to share the child tax credit information with clients. For context, is coming from someone who works in Texas at a maternal and child care health clinic. So maybe thinking about the complexities, I think that Rachel spoke to, maybe tying the link between how do we actually share what's happening so folks can actually access that credit.
Go for it, Keisha. Thank you.
No,
Yeah,
I was just going to
sure.
say, Rachel, you want to start?
Sure. No, I'm happy to. I mean, it's this is where, I think that the emphasis that we've talked about today on local partnerships is key, because, and with, as the tax code is changing, it is really depending on those local community partners, and local Vita sites, for example. These are the volunteer income tax assistance programs that are in communities that really are your local tax knowledge. I mean, these are volunteers who know the code in and out, who can help folks file. They are the best go-to resource in any community. But it's really also where too, I know that the IRS, they released a new operating plan last spring, following the infusion of about $80 billion that was authorized for the agency out of the Inflation Reduction Act last year or the prior year. And I would say that this is going to be a major focus of the IRS to really improve taxpayer services and outreach, especially to vulnerable communities who could tremendously benefit from these programs, such as the child tax credit. So I would say that, this is also why it's important that we adequately fund the IRS so that they can continue to invest in the resources that our communities across the country need. And so that folks do have access to the tools and resources and education. And if they don't, that others in their communities do. So that it really takes some of the stigma away from accessing these programs. And honestly, true, like just the miscommunication or the lack really of communication, because there's a portion of there are so many potential claimants out there who aren't claiming these credits that can otherwise that are eligible for them, and we've seen already the tremendous economic and health benefits to doing so if we can just increase their claiming of them.
Great. So I'm going to take that same question and ask a little bit more of that to Isabel, because I want to take a moment and have Isabel lift up some of the partnerships that you've engaged in that has really been helpful in increasing, encouraging, and getting the word out. This part that Rachel was mentioning, Rachel has already told us we have strong bipartisan support for tax credits. This is an issue that touches folks across the entire nation. And I think what you can give us, Isabel, is just a little bit more of the specifics on partnerships that have been successful in reaching communities and increasing the access, the knowledge, the information.
Sure. Well, big levers at the state level can drive a lot of traffic. So I'm talking about, for example, partnering with our unified benefits platform, which is called Colorado Peak, to have something about tax present there that people, especially during tax season, and some of our other benefits programs engaging in that way. It's very simple for them, and it does raise awareness quite a bit. And a media plan if you have the funding for it. I would also say there's a really huge need for targeted community-based work that is tailored to individual communities and what their language needs are, as well as their challenges and trust challenges in engaging with the IRS and the Department of Revenue. So understanding what makes people reluctant to file. Maybe they're worried it will impact their other benefits. Maybe they're worried it will impact their citizenship status or don't understand their eligibility. And it is those trusted voices in communities that can bring that information in an accessible way that we don't know or understand necessarily at the state. That's where partnering with those community-based organizations, some of them very new to us, very small, very targeted, has been critical. And they are vocal with us about how we should change our campaign to be more accessible, what materials and tools they need to get the word out. And it's really been a learning process with those community-based partners.
Thank you. Love that. All right, Dr. Merritt, any more questions from the audience?
Yes, we have a couple that really speak to the infrastructure around kind of traditional public health access to physical activity. And so one for Leandra in particular, could you talk a little bit more about, if at all, how the upper mobility model might address access to healthy food and physical activity?
Yeah, I know earlier it showed how there are 4 metrics that align with the health piece of the framework. And I acknowledge that those 4, of course, are not exhaustive, they're not comprehensive. And the reason for that was because of the very specific criteria we had around the metrics. However, there is an acknowledgement. We have this huge evidence resource library around other pieces that kind of connect to the pillars. And maybe I'll drop one in the chat really quickly, if that's helpful. This one is related to the pillar around the health piece. Oh, let me find that. Here it is. Drop it in the chat for you all. So that's the link to the evidence resource library, but under that, you'll see some assessments. You can kind of click that drop down and go to the healthy environment and access to good healthcare. And you'll see that there are pieces around nutrition, for instance. So just because it's not a specific metric underneath the pillar, it's definitely acknowledged that that is a piece of evidence that connects to health overall. So want to lift that up. Hopefully that's helpful.
Great, that's amazing. So I think we have time for one last question. And I'm going to turn to Dr. Merritt to make sure that we get that last question to be an audience question. And for your knowledge, we try our best to retrieve all of your questions from the Q&A panel and try to answer those offline if possible. So we will try to do that today. But Dr. Merritt, the last question is yours.
Thank you. And thank you all to the participants for such thoughtful questions. So I think it's important for us to maybe end on one that speaks to the future of this work and really thinking about how, when we're talking about increasing social mobility, how can programs and initiatives be modified to focus on investing and preservation of funds to promote multi-generational wealth?
That's a big one. All right. I'll give you get 30 seconds each to answer some version of this. And I'll start with whoever looks the most ready. And it looks like it might be Leandra.
I'm going to ask for a repeat of the question. I think I caught the last bit, but that'll be great to have a repeat. And then, yes, I can definitely answer first.
Sure. So thinking into the future, if we're trying to increase social mobility, how can we modify current programs and initiatives to focus on building multi-generational wealth?
That's a great question. So one piece that immediately comes to mind around this is the power of partnerships. We've already talked about it in this space, and I know that a lot of our participants on the line, I'm sure, are already doing a lot of this work, but I really want to reinforce the idea around cross-sector partnerships. Because health is so connected to so many areas, because economic mobility is connected to so many areas, it's really important to have this cross-sector work. So maybe you work in housing, right? But it's important to do that outreach to other areas, from health to education to workforce development, to create something that is a bit more sustainable when it comes to creating programs. It also helps so folks aren't necessarily fighting for funding. So I think I just want to reemphasize that point around just really the power that comes from long-term cross-sector partnerships when it comes to thinking about the future.
Thank you, Leandra. Rachel, Isabel, anything to add?
Yeah, I would just add that this is why at the Bipartisan Policy Center, we care about bipartisan solutions, because that's what makes durable policy. These policy supports need to be around for the next generation. They need to be certain for the current generation, so that families are, planning their finances around the kitchen table. They know what programs they're eligible for, and the impact that they can make on their finances. It's when the pendulum swings and these tools, these programs are being used as leverage or bargaining chips, right? That's not helpful. And so it's really that we support these programs and we reform them and we make tweaks. Leandra noted the importance of data and the right metrics to ensure that we're actually measuring program efficacy, but it's really that we make sure that these programs are around and that they're best targeted.
Amazing. Isabel, last word. Do you have anything?
I just think continuing to integrate that financial well-being strategies into public health and healthcare work, so that that positive feedback loop can take hold, because healthier people earn more, have more economic mobility, and vice versa. So economic mobility begets better health. And so just continuing to kind of make that case to our program partners, our funders, our leadership, so that we can lift people up and help them become more healthy and achieve their dreams.
Awesome. Well, a huge thank you to each of our panelists, our co-partner in doing the webinar today, the Bipartisan Policy Center. Thank you to AI Media Captioning, Keystone Interpreting, and all of the staff at TIFA who works behind the scenes currently and before today to get us to this point. Lastly, I want to thank each of you, our listeners. We would not be able to do this without you. This is clearly an important issue, and we look forward to sharing the recording along with the slides and additional resources with you at T as in trust, FAH.org and on the bipartisanpolicy.org center. Excuse me, the Bipartisan Policy Center's website in the coming days. Thank you so much for joining us, and I hope you enjoyed it. Have a great day.